Twitter will no longer enforce its COVID-19 disinformation policy, sparking fears among public health professionals and social media academics that the change could have major repercussions if it dissuades vaccination and other countermeasures to the still propagating virus. A one-sentence amendment to Twitter's online policies was noticed Monday night by observant users. It read, effective November 23, 2022, Twitter is no longer implementing the COVID-19 false information policy. After Elon Musk bought Twitter, several Twitter accounts began experimenting with the new restrictions and praising the platform's laissez-faire attitude by Tuesday. Public health professionals were unhappy by Twitter's decision to stop removing incorrect statements regarding the safety of COVID-19 vaccines, but also warned that it might encourage other false statements about the virus or the security and efficacy of vaccines. Eric Fiegelding, an epidemiologist, tweeted, "Bad news," advising users to resist spreading false information about the virus rather than abandoning Twitter. "Stay guys, don't give them the town square." The company's decision to change its strategy is a betrayal of its obligation to its users, according to Paul Russo, a social media researcher and dean of the Katz School of Science and Health at Yeshiva University in New York. While Twitter's efforts to stop false claims about COVID weren't perfect, he said that the company's decision to do so was not. To protect its users from hazardous content, the platform has a complete obligation, according to Russo. The situation is totally intolerable. Meanwhile, the infection is still spreading. Johns Hopkins University data show that as of Monday, the number of new COVID cases nationwide averaged close to 38,800 per day, significantly less than last winter but still a huge undercount due to decreased testing and reporting. According to the most recent federal daily averages, about 28,100 people with COVID were hospitalized every day, and about 313 of them passed away. Deaths and cases increased from 2 weeks prior. Yet a fifth of the U.S. population hasn't been vaccinated, most Americans haven't gotten the latest boosters, and many have stopped wearing masks. Musk announced last week that he would amnesty account users who had been banned from Twitter. Representative Marjorie Taylor Greene's personal account was suspended this year for persistently breaking Twitter's COVID guidelines. He has also reinstated the accounts of several other individuals who circulated false information about COVID. Recent tweets from Greene challenge the efficacy of masks and make erroneous assertions regarding the security of COVID vaccines. Platforms like Twitter and Facebook have struggled to respond to the flood of false information about the virus, its causes, and the response to it since the pandemic started. Twitter has had difficulty enforcing its policies on COVID falsehoods. On Tuesday, it was challenging to pinpoint just how the platform's standards may have altered. Posts containing false claims about natural cures or vaccinations could still be located. Tuesday, messages sent with San Francisco-based Twitter asking for clarification on its policies on COVID-19 falsehoods were not promptly answered. Tuesday's search for terms commonly used to refer to false information about COVID turned up a lot of deceptive material as well as automatic links to reliable sources like the Centers for Disease Control and Prevention and helpful resources about the virus. Speaking at a Knight Foundation meeting on Tuesday, Ja claimed that a combination of factors, including genuine uncertainty about a fatal sickness, contributed to the propagation of false information about the virus. According to him, just banning some content won't help consumers obtain reliable information or give them more confidence in what their healthcare providers are telling them. Regarding eradicating false information regarding COVID, Ja stated, "I think we all have a collective duty. Tens of thousands of people will physically die needlessly as a result of not getting this right, of spreading that disinformation."